You're listening to Sports Medicine Weekly with Dr. Brian Cole and Steve Cashel on 670 The Score.
Back here on this Sunday morning, Sports Medicine Weekly, I'm Steve Cashel with Dr. Brian Cole. It's time now for our Ask the Doctor segment. It gives our listeners the opportunity to have Dr. Cole address their specific sports injury issues. Easy to submit a question. Go to our website, sportsmedicineweekly.com. Homepage, you'll find a link underneath the photo of Dr. Cole and yours truly. Click on that link and you can submit your question. Got a great one from one of our listeners, Dr. Cole. He asked this: Dr. Cole, after undergoing surgery 8 months ago, I'm now playing golf again, but my shoulder is very sore after 18 holes of golf. What's the best treatment that I can do following my round?
The first most basic tenet here, Steve, that this listener is asking about is what's the role of pain and soreness in a sport, and am I going to make the problem worse by ignoring it? I know that's not what the listener asked, but I can tell you that's what most people are concerned about, because I know you, with your passion for golf, you'd love to know that, hey, I'm a little sore, but I can play through it. Is that safe to do? And I will tell you that there are very few conditions that we treat that will be made worse by participating in a sport despite having soreness. So we often talk about good pain versus bad pain, but I think that's an important thing for our listeners to know. That being said, sometimes, look, people get sore even without a history of injury after playing lots and lots of holes. And 18 holes I know is pretty routine. I'll tell you, between me and you, Steve, I'm good for 12. But that's a different story. That's more about my golf ADHD, I guess. But, that being said, it's likely that this individual is just starting to play golf on a shoulder that's sort of adapting to increased stresses after having surgery, and soreness is sort of part and parcel to resuming activities. And I would not generally worry very much about that. What can they do? Stretching, sometimes taking anti-inflammatories. 20 minutes of ice after participating in a sport in this setting, especially having previous surgery on the shoulder, can make a huge difference. So soreness is not uncommon. It usually doesn't mean there's something sinister going on in the background. And I think if you just treat it properly and still try to participate where you can, but anti-inflammatories and ice can make a huge difference.
Great stuff, Dr. Cole. Great show. Appreciate it. Best of health to you, your patients, your family. We'll talk with you again next Sunday.
Looking forward to it, Steve.
Reminder, everyone, our podcast segments always available to hear on the Sports Medicine Weekly blog, also through Apple, Google, Spotify, Pandora, YouTube, and iHeartRadio. Net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the liveactivenow.org fund. Many thanks to our producer, Shane Reardon, also David Cole. He manages our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Cashel. We say so long. We thank you for listening to Sports Medicine Weekly. We'll be back again next Sunday, 7 a.m., a brand new edition of our show, only on
670 The Score.
Have a great Sunday, everybody. Stay healthy.
You've been listening to Sports Medicine Weekly with Dr. Brian Cole and Steve Cashel, only on Sports Radio 670 The Score and 670thescore.com, Chicago's sports station.